Assalamu alaikum and good afternoon, everyone. At first, I would like to express my heartfelt, sincere gratitude to the chairpersons for chairing the session and also the esteemed audience and my fellow colleagues for taking their time to join with us. This is really an honor and privilege to have the opportunity to present my work with distinguished gathering of the delegates expert in the field of radiology, nuclear medicine and oncology. I am also thankful to the organizing committee for arranging such an outstanding conference. The title of my work is Navigating the Unknown, Evaluating the Role of FDG PET-CT in Detecting Primary Tumors in Cancer of Unknown Primary, a 5 years institutional perspectives
Check,
in
check.
Bangladesh. I am Dr. Fatema Tuz Zohra. I have passed MBBS from Shohid Sohrawardi Medical College in 2013. Then I have completed MPhil in Nuclear Medicine and Molecular Imaging from National Institute of Nuclear Medicine and Allied Sciences in 2018. After passing MPhil, I have joined Bangladesh Atomic Energy Commission in 2019. Currently, I am working as an assistant professor at the Institute of Nuclear Medical Physics, Shavar, in PET-CT division. I have additional responsibility in PET-CT division at INMAS Mohakali since January 2024. Carcinoma of unknown primary refers to metastatic cancers where no primary tumor can be identified. It accounts for about 3 to 5% of all cancer cases and presents unique diagnostic challenges and often affects treatment decision. Understanding the role of imaging techniques like FDG PET-CT is crucial for patient management. PET-CT combines metabolic and anatomical imaging to enhance detection of malignancies. It is particularly useful in identifying metabolically active tumors that may not be visible on conventional imaging like CT or MRI. It can evaluate the disease progression and guide biopsy procedures as a single-shot imaging tool. Today, I will share our 5 years institutional journey at the Institute of Nuclear Medical Physics, Shavar, where we have explored how PET-CT has revolutionized our approach in detecting primary tumors. A total of 108 patients diagnosed with carcinoma of unknown primary were referred for whole body FDG PET-CT scan between 2019 to 2023 at INMP Shavar. Whole body PET-CT scan done after the IV injection of FDG. Patient visual examination and metabolic activity by SUV were used to analyze the PET-CT images. Formal follow-up with histopathological data was correlated accordingly. This table shows the distribution of age and sex. We found 65% male and 35% female, and majority of the patients fall within 45 to 64 years age. These pie charts represents the distribution of the comorbidities of the patients. The most common comorbidity is diabetes, hypertension, which is 24.1%, followed by diabetes mellitus, which is 22.2%. This chart depicts the known metastatic sites before PET-CT scan. The most frequently observed metastatic sites were cervical lymph node, which is 33%, followed by bones and liver. This chart summarizes the histopathological classification of known metastases. As seen here, blue, adenocarcinoma is the most prevalent histopathology, followed by squamous cell carcinoma, poorly differentiated carcinoma, and others. This chart illustrates the treatment before PET-CT scan. We found 60 baseline PET-CT scan done in 60% patients, and 20% patient had chemo or radiotherapy before PET-CT scan, 11% patient had surgery before PET-CT scan, and chemo and radiotherapy and others done in 9% patient. We found 70% cases disease progression. We found disease progression in 70% cases. That means we found multiple new metastatic sites other than known metastatic site. We found 25% primary, that is 27 cases out of 108 patients. This chart summarizes the primary sites of organ detected by PET-CT. Lung was the most common primary site of organ, followed by stomach, pancreas, and others. And this is the pictorial image. This patient came with metastatic hepatic mass, and a complex mass originating from the ascending colon was noted, identified as primary adenocarcinoma based on histopathology. Here MIP, coronal image and axial image shown. This patient came with metastatic lesion in the left tibia. So PET-CT scan done, and we found a soft tissue density mass in the right upper lung, which is identified as primary adenocarcinoma through histopathological examination. This patient came with multiple hepatic metastatic lesions, and we found soft tissue density hypermetabolic mass in the body of the pancreas, which is identified primary adenocarcinoma based on histopathology later. This patient came with multiple metastatic lymph nodes, bilateral, axillary, cervical, and supraclavicular regions. Hypermetabolic soft tissue mass is seen in the stomach, was identified and confirmed as primary adenocarcinoma. This patient came with metastatic left cervical lymph node, and we found a soft tissue density area in the right tonsillar region, confirmed as primary squamous cell carcinoma through histopathology. So the FDG PET-CT whole body scan is a single-shot, non-invasive, highly sensitive imaging modality demonstrating a 25% success rate in identifying primary tumors in my institution. Disease progression is identified in 70% cases. It significantly aids in comprehensive tumor staging, facilitating optimal treatment selection and improving prognostic assessment precision. And thank you, and this is my institute.